All right, hi Ethan, I'm Karen. I'm going to do a physical assessment on you today. First, we're going to just start with the head. And here we feel for lumps, bumps. We're looking to make sure the face is symmetrical. We're looking at the ears. While you're here, you can feel lymph nodes. And you can run your fingers right down here. We'll go ahead and feel the carotid pulse. Remember, you do not do both at the same time. And where did my flashlight? There we go. All right. All right, now we're going to examine the eye. First, I'm going to just look at his pupil, and it constricts. Now we check for concentric. Concentric is when you shine the light, the left constricts, and then the right. So notice here, we shine it in the right, and the left constricted. Now we're going to check for accommodation. And so follow here. And notice the pupils constricted, and now they dilate. We're going to do the 6 cardinal signs here. This is a shape of H, down, here, up, and down. Very good. We're going to go ahead and just tilt your head back. We're just looking at his nose. And we're going to look in your mouth. Just stick your tongue out and say, ah. And do ah. Very good. We're looking at his teeth. That looks good. All right, so that basically took care of the head. I'm going to go ahead and just looking at the skin while we do the assessment. I'm going to go ahead and have him squeeze my fingers. Very good. So we're checking for grip strength. You want to make sure they're equal on both sides. We can now check for the pulse. This is your radial. And then we'll check the brachial pulse. Good. You can do both at the same time, brachial and radial, but not carotid. Go ahead and slide back. Okay. And we want to move that thing. If you just stay seated upright real quick, I'm going to listen to the heart. And so we put it right here. And we're listening here. Go here. Here. Now we're at the mitral. And we probably can feel his apical, and I can't. All right, now we're going to listen to the lungs. All right, so deep breath, and out. Again, and out. And listen again, and out, and again. Now we're going to listen to the back of the lungs here. All right, deep breath. And notice we go from right to left. Deep breath. Then we drop down. Good. Again. Just want to be careful your patient doesn't hyperventilate here. Deep breath. And again. Nice deep breath. All right. Then notice we're going to the side here. Deep breath. All right. And last one. Good. All right. I'm going to have you lay back. It's coming off my head. So it's good. All right. Just lay right back here. So we are going to put him at 30. If we had him at 30 degrees, we would look here. We can look for the JVD. And this is the vessel here you're looking at. So right now, we're looking at his abdomen. We don't want to palpate yet. So first we're going to listen. This is auscultate. This is coming up my head. And you listen to all 4 quadrants there. And here we can palpate. And while I do this, I'm watching his face. If he had any pain, make a pain face. Then he has pain there, and you would investigate that pain. All righty. Now we're going to slide this up and do the popliteal pulse. So if you cannot feel the pulsatile pulse, do not worry. You will just come down here, and if you get your pedal pulse, you're good, and he has a very good pedal pulse. Now I'm going to have him push against my hands, good, and then towards your head. And this is dorsiplantar flexion. And again, you're comparing the strengths there. One other thing, when you are doing the lung sounds, you want to look at his chest to make sure he's breathing evenly. And we also want to look at the AP diameter. And notice here he is 1 to 2, and that is a normal finding. While you're looking at the skin, take notice of ear piercings, tattoos. Have mole here, maybe mole here and here. And you'll also want to look at the fingernails and check for capillary refill. And you can do that in both hands. There we go.